Ready.
Dr. Lisa Indar, Assistant Director, Surveillance, Disease Control at CARICOM. Thank you for agreeing on such short notice to do this brief interview about the health emergency or health alert that the region and indeed the globe is dealing with. The World Health Organization just yesterday has declared the novel coronavirus as a global health emergency. And the Director General even went so far as to apologize early in the week when he visited China for referring to the worldwide risk as being moderate. What does this new classification underscore about the seriousness of this outbreak?
Okay. For an illness or a new disease to be classified as a public health emergency, public health emergency of international concern, it means then the likelihood of spread to global spread is likely. But when a classification of a public health emergency of international concern means that WHO, World Health Organization, and other organizations are now free to give resources for prevention and control, for building, for laboratory capacity, and so on to respond to a public health emergency. So the novel coronavirus is new, because it's called a novel coronavirus, and because it's so new, much is not known about it at the moment. We have seen an unprecedented increase in China, and that rapid increase, we have almost 10,000 cases to date, obviously, and now it's spread to over 17, 18 countries, is of concern.
Yeah.
So given that spread, and given now you need resources to help China to make sure you contain this, you want to avoid the risk of importation into other countries, and especially in the Caribbean. It was declared a public health emergency of international concern, so that resources can then be free to have that global reach for prevention and control.
Okay. CARICOM member states have been initiating their own responses to minimize the risk of the virus entering their jurisdiction. Some have quarantined persons who are entering into their countries from China. Some have imposed travel restrictions to and from China. Are those measures necessary?
Well, let's start by saying every country is a sovereign state, so they have that right to impose whatever necessary risks whatever necessary precautionary measures that they seem fit. That said, from a stand from CARICOM, and we would have just said this in our press release yesterday, even though it has been declared a public health emergency of international concern, CARICOM still deems the risk to the Caribbean is low. And that is based on three things. One, there are no reported cases as yet in the Caribbean. And for a person to actually come from China to the Caribbean, they have to go through multiple levels of screening because they had no direct flights. So it means they may actually have to go through to the US, to the UK or Canada, where they will be screened. And if a person is screened there and is showing sign of illness or may have been in contact with someone who was infected, of course, then that's a different approach in terms of isolation. So the likelihood of someone coming to the Caribbean directly from China is greatly reduced. So the risk then we still deem as low. But that does not mean we can't be vigilant. So what we're really encouraging our member states is to ramp up ports of entry screening. The first thing is to avoid that importation. So we have to be even more careful in terms of being vigilant at our ports of entry. And we know we have multiple ports of entry. So it's not just airports, it's seaports. And some of our countries like Suriname and Guyana can be across across land. So we have to make sure that that vigilance is there.
Okay.
Yes. The other thing we want to encourage is for our immigration department to also ramp up vigilance, to probe, to ask the questions in terms of travel. Because in today's travel, we have persons with multiple passports. So you could actually leave one country and it may not show up because we have another passport. So probing is also important. So we are encouraging that regional approach. Of course, CARICOM can only provide technical guidance, and this is based based on the science. The WHO and the IHR has indicated that there are no travel restrictions.
Okay.
Travel or trade restrictions. However, you may have seen on the news that CDC, the U.S. Department of Health, and Center for Disease Control is saying avoid non-essential travel to China.
Yes.
And the same thing we would have recommended. We would base our guidelines based on the WHO recommendations. So we are recommending that if you do not need to go to China, do not go. But at the same time, we're saying to step up your ports of entry surveillance.
Apart from what you've just said, I'm sure that there is a regional response that has been activated or is going to be activated. Could you shed some light on that?
Well, CARICOM is a CARICOM agency, and we hold the lead for health response. So we activated our incident management team, which is our IM team, literally last week, Monday, since this started to increase and there were news of this new virus. That incident management team allows us for regional coordination. What does that mean? With our member states, as well as with our agencies. We have many partner agencies, PAHO, and then our Public Health of England and Canada and the US and so on. So it allows for that coordination so that we're ensuring a harmonized scientific response. And some of the things we have done since then is that we have been issuing daily or twice per week situation reports. And because it has been changing so much.
So rapidly.
Yes. In addition to the situation reports, we would have convened virtual meetings with our chief medical officers of health, our laboratory directors, our national epidemiologists, to discuss, the epidemiology, the clinical nature, laboratory capacity, ports of entry, and so on. We would have also convened the regional coordinating mechanism for health security. So CARICOM is the lead for that, and this actual body was developed for regional coordination of emergencies that can pose global or regional health risk. So we convened that meeting on January 29th with multiple agencies, including SEDIMA and INPACS and CARICOM, and our international agencies like Public Health England and CDC, as well as even the Dutch and the French. And at that time, we all agreed with the same principle, based on the fact that we have multiple sources of screening, and that there's no direct flights on a reported case would deem the risk to be low. But we also said that there is a need to be vigilant.
Okay.
In addition to that, we would have sent out we would have produced multiple technical guidelines, all of which is based on our WHO as well as our CDC guidelines. So travelers guidelines, guidelines for travelers' health. We would have produced an algorithm. So if you do see a suspect case, what do you do? What are the processes to go through? We have just developed a risk communication document that really guides you through the possible levels of risk, ports of entry, screening documents, and so on. We are liaising with our international partners. We actually met my director, Dr. Joy St. John, met with Professor Ferguson, who produced one of the first report of this, to discuss the etiology. We have met with SEDIMA and the National Disaster Coordinating teams to discuss response. But I want to emphasize we're still in preparedness phase. Right? So we want to alleviate the fear, we're in preparedness phase, and we are doing all that is necessary. Producing the reports, making sure that we are looking at preparedness and preparing for response if necessary.
Talking about the fear, social media has not been doing a good job of alleviating that fear. In fact, several videos are going around. I saw one last night about the virus not being new because one of the disinfectant brands have labeled preventing the spread of the coronavirus.
Yes.
So, and there was another one to say that you mustn't visit this place or that place locally.
Yes.
So, what advice do you have for a panicking public?
Right. Well, I went to, yesterday, our director, Dr. St. John, and myself was part of a panel with UE in Jamaica, where it was entitled Demystifying the Myths. And the thing is, these are all myths. we would advise the public to go to a reputable website. And who is that? WHO, CDC, CARICOM. This is the science. A lot of those videos and media sensationalization is causing panic. So we want to really appeal to the media to work with us, the public health department, work with CARICOM, work with CARICOM, to convey the right message. There is no basis to some of these videos and all these myths that are going around. And what we're trying to do then is to revamp by providing that information. We have a communications department, that is giving travelers advice, that is giving advice that that the risk is low, but these are the things you should do. So all we can do then is to revamp our communication and work with our media to say, well, it's all in our best interest to carry out the right information.
The final question I want to ask you, maybe a little provocative, but I'll ask it anyhow. Do we have the capacity to deal with any number of incidents of the novel coronavirus in the region?
Well, the coronavirus is similar to when we were preparing for SARS. Mm-hmm. So in terms of capacity, the region has built their capacity in terms of emergency preparedness and response. So in terms of laboratory capacity, in terms of response. So every country has the emergency and response plan. So this is not something new. Mm-hmm. Viruses come and go, so they know what to do. So it's a matter of, taking it off, dusting it off, and just like SARS, it's the same type of response. Every country has response teams. They have a triage of how the information should flow. If you do have a suspect case, what do you do? If you have to isolate, how you isolate. The only difference is that to isolate this, you may need different primers or media, and that's something CARICOM is already getting. And hopefully by Monday we can leave the test at CARICOM. So, but yes, from that point of view, the region has been equipped since those days. It's a matter of grouping together and for country teams to group and get themselves all familiarized so that there's that coordinated approach.
Dr. Lisa Indar, thank you very much for providing such useful information and for comforting us, reassuring us that we don't need to panic.
No, don't panic. Yes.
Thank you.
Oh dear. You had me going.